Welcome to the third annual Texas Heart Institute Baylor St. Luke's Medical Center Global Cardiovascular Symposium. I'm Dr. Joe Rogers, President and CEO of the Texas Heart Institute, and on behalf of our entire organization, I'm glad that you've joined us today. For over 60 years, the Texas Heart Institute has been committed to pioneering clinical care, research, and education intended to improve the lives of patients with cardiovascular disease across the globe. This work continues today through innovative translational science and increased focus on preventative cardiology and population health, and exciting transformational work in regenerative medicine, drug discovery, electrical therapies for heart disease, and development of new circulatory assist devices and preservation methods to increase the number of lungs available for transplantation. But regardless of the specific initiative, the Texas Heart Institute continues to look forward with the vision to bring the future of cardiovascular health to life. The third annual Cardiovascular Symposium presented today is intended to bring you the most contemporary evidence that will guide the treatment of patients seen in your office next week. We've not shied away from controversy in areas of clinical importance for which there is minimal or conflicting data. You'll hear from experts about how they solve these clinical dilemmas, and we've built time into today's agenda for robust discussion. We'll start the day with 3 exciting presentations, providing focused updates on important guideline documents released in the past 12 months, and an important class of medications that's changing the outlook for patients with premorbid and overt cardiac disease. That will be followed by an intriguing session highlighting controversial issues in coronary and valvular heart disease management. In session 3, you'll hear from experts addressing recent advances in clinical trials in arrhythmia management, thoracic aortic disease, valvular heart disease, and heart failure. The final session of the symposium will focus on the important topic of access to care, an issue critical to our collective vision to reduce the global burden of cardiovascular disease. Before I turn the program over to our moderators for the first session, I would like to thank the organizing committee of this year's meeting, Dr. Ajit Nair, Nikos Diakos, Lauren Barron, and Alexander Pastalian. I would also like to thank Dr. Juan Carlos Plana for his insights and guidance with the program, and the Texas Heart Institute Department of Continuing Medical Education. It is my sincere hope that you enjoyed today's program and leave this session with new ideas that will stimulate clinical research and improve patient care. Enjoy the third annual Texas Heart Institute Baylor St. Luke's Medical Center Global Cardiovascular Symposium.